My name's Will Duncan. I'm now an orthopaedic surgeon that specialises in mainly knee and hip surgery. About half my practice is younger sports patients, so ACL injuries and meniscal injuries, and the other half of my patients are patients that have got worn out knees and arthritis, and they're usually a bit older in the older population that want to keep moving and keep their active lifestyles. I've always had a really keen interest in practical things and using my hands, and grew up in a farming community and really sort of thrived at school in woodwork and metalwork rather than in the school classroom. I did enjoy the sciences, and as I studied through medicine I found it fascinating that you could sort of combine the two, using your hands and practical knowledge to rebuild knees and hips and ligaments in the body. And so I pursued orthopaedics and then trained in Adelaide and overseas in a couple of specialist centres in the UK before settling down back at Wakefield Orthopaedic Clinic. There's a few different groups around town. The Wakefield Orthopaedic Clinic had quite a lot of senior, very well respected surgeons that had a reputation of being leaders in orthopaedics and also conservative with their management. They weren't too aggressive at operating on every patient. They had a lot of other good methods of helping people get better, and I'd sort of trusted them and wanted to come and work in a trusting environment. Wakefield Orthopaedic Clinic is connected with a sports clinic that has excellent sports physicians and really good sports physios and arthritis physios. So there's a connection with our clinic with this other clinic that can provide integrated care for the patients. The hospital that we're based in, the Calvary Adelaide, has all the facilities that we need on site, so X-ray, MRI scans and other specialty groups that may be required during your hospital stay. So the clinic provides quite a holistic management program for all the patients. I think the most rewarding thing is seeing people get back to their active lifestyle, and whether that's young people getting back to sport or back to work if they've got a manual job, or the older patients that are getting back to their usual activities of bushwalking and holidaying and enjoying their lifestyle with pain-free movement. So it's good to see patients that have been injured or worn out a joint come in, have their surgery and then get better again with the rehab and get back to their usual life. That's the rewarding part.